Great, well, let's go ahead and get started. Welcome, everyone. I'm Anna Izagiri. I'm Communications Director with the Committee to Protect Healthcare. We appreciate you joining us today. As you know, members of the U.S. House are back in districts this week for their recess, and physicians are calling on them to use this time to explain their support for massive cuts to Medicaid. The physicians joining us today will share how these cuts could impact their patients and communities, and why their representatives should cease further support for these cuts. Before we begin, I would like to note that the physicians are speaking as individuals and with us at the committee, not necessarily on behalf of any employers. So we respectfully ask that you please only refer to them in any of your coverage as they introduce themselves on this call, and please do not include any employment information unless they expressly share that. So thank you in advance for being respectful of that. Without further ado, I will introduce our first speaker, Dr. McCollum.
Good morning. My name is Dr. Sherry McCollum. I'm an adult rheumatologist, and I'm located in Warrenton, Pennsylvania, which is PA District 1, which is Brian Fitzpatrick's district. I'm here today with my fellow physicians to call on our members of Congress who are back in the state during their recess to protect healthcare for our patients and Pennsylvania families and to stop trying to cut Medicaid. As physicians, we are deeply concerned about our Republican members of Congress who want to slash $2 trillion from the budget, including $880 billion in healthcare funding through Medicaid. And while they're back in their districts for the House recess, it's important that they hear from constituents like us about this critical issue. Medicaid provides healthcare for 3.1 million people across Pennsylvania. In fact, I trained at Einstein Medical Center in Philadelphia. And at that time, 88% of our patient population were patients who received Medicaid benefits. If they did not have Medicaid, they would not have access to necessary care that places like Einstein provide. If Medicaid were to be cut or eliminated, Einstein would likely need to close as it could not survive the financial loss this would cause. We've already lost Hahnemann University Hospital in Philadelphia. It closed in recent years, and the Crozer Keystone Health System is on the brink of closure as we speak. To lose another large tertiary care center would be absolutely devastating for Philadelphia and its surrounding suburbs. And cutting Medicaid affects more than just the beneficiaries. It affects the entire population because they will have less access to health care because facilities shut down. 3 kids out of every 8 in Pennsylvania get health care through Medicaid or CHIP. In fact, I have several acquaintances who work full-time in well-paying industries, but the cost of benefits for their children through their employers is just not feasible. They rely on programs like CHIP to keep their children safe and healthy. More than half of all nursing home residents are covered through Medicaid in Pennsylvania, and nearly 30% of Medicaid enrollees are seniors and people with disabilities. If Medicaid were to be defunded or eliminated, where would all of these nursing home patients go? Who will provide them their necessary around-the-clock care? In the congressional district where I live, Pennsylvania's 1st, which Congressman Brian Fitzpatrick represents, more than 117,000 people are at risk of losing their health care and not being able to see a doctor when they get sick or injured if Congress cuts Medicaid. This includes 52,016 children under the age of 19 and 15,000 seniors over 65 in Representative Fitzpatrick's district, according to the U.S. House Committee on the Budget. Make no mistake, Republicans in Congress and the Trump-Elon Musk administration are taking away people's health care so they can give huge tax breaks to the wealthiest people in America. It's no wonder Representative Fitzpatrick has been refusing to hold town halls, even when he's back at home for the, quote, in-district work period, unquote. He probably doesn't want to acknowledge the reality. Taking away people's health care will have devastating consequences for Pennsylvanians because when people can't see a doctor or afford to get the treatment they need, many people will suffer. Some will go bankrupt because of huge medical bills, and unfortunately, some people may die. Doctors see firsthand how access to healthcare can improve and save lives. And we also see the flip side, that when people can't see a doctor, they get sicker and suffer needlessly. Every Pennsylvanian must stand up and speak out against this reckless Republican plan to take away people's ability to get medical care so politicians can give huge handouts to billionaires. My colleagues will share their perspectives, stories, and what's at stake in their communities. I'd now like to invite Dr. Whalen to speak.
Thank you, Dr. McCullum. I'm a pediatric surgeon living in Allentown, Pennsylvania, Pennsylvania's 7th district, with first term recently elected Congressman Ryan McKenzie. Nearly every physician in Pennsylvania and across this nation has firsthand stories about how access to health care protects health, inspires hope, and transforms lives. For working Pennsylvanians who don't have health care through their employer and who simply cannot afford insurance premiums in the marketplace, Medicaid is how they get health care, and it is a lifesaver. I have cared for many children over my career who live with severe conditions such as birth defects or cancer or the impact of trauma. I've cared for patients who couldn't see a doctor for the longest time because they didn't have health coverage and couldn't afford to get treatment, allowing their disease, through no fault of their own, to get worse. Thanks to Medicaid, they now have a way to see a doctor and get the treatment and care they need to manage their conditions. In the process, they are healthier, they can better care for their families, they can work, they can give back to society, and they live fuller and more rewarding lives. I cared for many trauma victims over the years, but one stands out: a 3-year-old with a gunshot wound to the chest. A gun had been fired outside of his home that penetrated the wall as he was sitting with his family watching television. He nearly died, had a prolonged hospitalization, but had a full recovery thanks in large part to Medicaid. I want to let my member of Congress, Representative Ryan McKenzie of Pennsylvania's 7th District, know that cutting Medicaid endangers the health and safety of more than 196,000 people in his district who depend on Medicaid. I have communicated this to him. And while he has stated he has not and will not vote to cut Medicaid, he has not explained the math of what he did vote for in terms of discretionary budget cuts. This will include 99,677 children under the age of 19, representing more than 50% of the youth in his district. There are also 18,000 seniors over 65 in the 7th. It's perhaps unsurprising then that Representative McKenzie has also been avoiding holding open town halls, but has been shielded by a moderated conference call. We want Representative McKenzie to know that slashing Medicaid will take away life-saving health care for children, pregnant women, seniors, and people with disabilities. Doing this just to give tax handouts to billionaires is dangerous and morally wrong. What we want to make clear is that cutting Medicaid also puts healthcare at risk for every Pennsylvanian, not just those on Medicaid. We see all too often that when sick people have no health coverage, they delay care until a medical condition becomes an emergency that requires complex, costly interventions, which are then uncompensated. And these unpaid medical bills all add up and get passed on to consumers in the form of higher premiums. Reckless and irresponsible cuts to Medicaid affect all of us. And Congressman McKenzie has a duty to his constituents to ensure they are healthy, safe, and secure by protecting Medicaid from any cuts. I'd now like to turn this over to Dr. Teig to speak.
Thank you, Dr. Whalen. Hi, everyone. I'm Kate Teig, a general pediatrician in Lackawanna County and the current president of the Pennsylvania chapter of the American Academy of Pediatrics. As a pediatrician and resident of Pennsylvania's 8th Congressional District, I would like Representative Rob Bresnahan to hear that any cuts to Medicaid or CHIP will endanger the health, safety, and lives of our district's nearly 230,000 residents, including those of the nearly 110,000 children under the age of 19 in this district who rely on Medicaid and CHIP for essential healthcare services. Essential pediatric healthcare includes prenatal services for pregnant women, newborn and infant well care visits, including life-saving vaccinations, as well as hearing, vision, and dental care for children of all ages. Additional services provided through Medicaid include speech, occupational, and physical therapy for all children, including those provided in our local school districts. Medicaid helps support comprehensive and wraparound services for children and youth with special healthcare needs, such as home care and long-term services that employer-sponsored healthcare does not cover. Pediatricians recognize the massive increase in mental health disorders in our children and adolescents over the last 10 years. Medicaid and CHIP provide coverage for proper screening and early detection of behavioral and mental health conditions, and ensure adequate treatment plans, including home and school-based therapy. Pennsylvania is very fortunate to have multiple high-quality pediatric children's hospitals across our state. Cuts to Medicaid and CHIP will devastate these hospitals' tertiary pediatric services, resulting in dangerous cuts to revenue that will lead to fewer staff and fewer available beds to care for the sickest of our children. As parents or grandparents, do you want to see life-saving pediatric care disappear from Pennsylvania? What will you do if your child is severely ill? I am very fortunate to care for some truly wonderful children who rely on Medicaid services due to complex medical conditions. For example, one 5-year-old little boy in my practice has the most infectious smile that lights up a room. He suffers from a rare genetic disorder that resulted in a brain anomaly that prevents him from walking or running like his siblings. He also has cortical blindness, type 1 diabetes, and a seizure disorder. This family relies on Medicaid to provide complex care for their son in the safest possible manner so he can receive life-saving medicines and equipment that helps him to breathe at night. His physical, occupational, and speech services are critical to his success each week as he learns to play, move his body safely, and eat sustaining food. No legislator should decide that Mason is not worthy of quality health care and that Medicaid is not needed. Children are our future, and unfortunately, they are not able to cast a vote on this issue. It is time for citizens and lawmakers from the 8th Congressional District and across Pennsylvania to stand together and support quality health care for our most valuable residents. Representative Bresnahan, our kids deserve your support. I'd now like to invite Dr. Taylor to make some remarks.
Thank you, Dr. Teig. I'm Deborah Taylor. I reside in Carlisle, Pennsylvania, where I retired in January of 2020 after practicing internal medicine for 30 years. I live in Congressman Scott Perry's district, Pennsylvania's 10th. Like my colleagues' representatives, Congressman Perry has been avoiding holding town halls, even while on recess right now. All of these representatives voted for the budget resolution that paves the way for massive cuts to Medicaid. More than 168,000 people in Congressman Perry's district count on Medicaid for their health care, and they're at risk of losing access to a doctor and treatment under Republican budget plans. The people Republicans are putting at risk include 89,000 children and 15,000 seniors in the 10th Congressional District. They are children who struggle with asthma and whose Medicaid and CHIP coverage helps them afford their inhalers and nebulizers, which they need to breathe. They are older Pennsylvanians with cardiovascular diseases, and Medicaid is what stands between them and a heart attack. Donald Trump and Republicans in Congress want Pennsylvanians to go without health care so they can give tax handouts to billionaires like Elon Musk, and that is simply unacceptable. The reality is that most of the people who will be harmed by this reckless trade-off to cut Medicaid for billionaire tax cuts are folks who live in rural Pennsylvania, children and seniors. As my colleague mentioned, hospitals and healthcare facilities in rural Pennsylvania face closures if Congress guts Medicaid, making access to healthcare even more difficult for rural Pennsylvanians. Health insurance premiums will go up for Pennsylvania families and small businesses, threatening their financial stability. Working families are already having a hard time making ends meet. Making rushed, indiscriminate cuts to Medicaid will take health care away from the people who can least afford it. Mr. Trump and congressional Republicans' sweeping cuts will have a long-term, devastating impact on Pennsylvania. People will be hurt. People will lose the shirts off their back. People will suffer, and some people will also lose their lives. While our representatives are back in our state this week, we urge them, we plead with them to listen to us, and stop their unconscionable support for cutting Medicaid. Thank you.
Thank you so much, Dr. Taylor, Dr. Tighe, Dr. Whalen, and Dr. McCollum. We'll now open it up for questions. If you have a question for any of the physicians, there's a few ways you can go about asking that. You're welcome to type your question in the chat box or in the Q&A, and I can help read those aloud. Or if you prefer, you can raise your hand and I can allow you to unmute to ask your question verbally. So I'll give a few moments for folks to be able to type those questions or raise their hands. Okay, I had a question chatted to me. I will read. If these Medicaid cuts do go through at a large scale, what could Pennsylvania look like 1 year from now or even 5 years from now? That's for anyone.
I think the first thing that you'll see, there'll be a significant reduction in hospital facilities that remain open across the Commonwealth. And that includes adult care facilities as well as pediatric facilities. That increases wait time. It obviously makes communities and communities where hospitals serve at a difficult disadvantage because they no longer have employees and revenue to help support their tax base. But the biggest thing for patients is it results in longer commute to receive life-saving care, which delays in our profession is unsustainable and undesirable.
And if I may add on to Dr. Tighe's remarks, Dr. McCollum mentioned in her remarks that institutions have either closed because of finance or are on the brink of closure, such as Crozer Chester. Although billions and billions go into healthcare institutions, the margins in healthcare institutions are very, very modest. And just, I think last week, it was reported that in the last fiscal year, even the biggest in the state, UPMC, lost $1 million a day on operations. This shock to the system that Medicaid cuts would impose will not only close the smaller hospitals that are so desperately needed, as Dr. Taylor poignantly pointed out to us, but it will impact the delivery of care in every single healthcare institution throughout the Commonwealth.
Yes, just to reiterate what my colleagues are saying, you're going to see a big scaling down of what services are even offered at larger tertiary care centers because those margins are already so thin. If they're not getting, payments or reimbursements from Medicaid because it doesn't exist anymore, they're not going to be able to employ as many healthcare providers to provide that necessary care. So wait times are going to get longer to see specialists. And in a specialty like mine, rheumatology, where wait times are already pretty astronomical because there's not a lot of us, it's going to get really, really bad. My other concern is too for nursing home facilities because the majority of patients living in nursing homes are Medicaid beneficiaries. What's going to happen to those facilities? They function based off Medicaid reimbursements, and these patients require 24-hour supervised care. So who's going to provide that if those facilities have to close? Because oftentimes it's because the family is not capable of providing that care or doesn't have the resources to provide that care themselves, like getting a 24-hour in-home aid. It affects more than just the beneficiary. And that's what I think our representatives aren't understanding, is that this is not going to affect just that small population that they have deemed to be lazy and not wanting to work and just like stuck the system and bleed it dry. That's not the majority of people on Medicaid. And, it's going to have wide sweeping reaches to everybody involved in healthcare.
I've already personally witnessed in our community hospital the people being not just triaged, but treated in the waiting room area because there's not enough help to take care of them in the hospital. And there was an unfortunate gentleman that I'm sure had pancreatitis and was completely miserable with abdominal pain and vomiting. And he was forced to wait in the waiting room and try to get comfortable laying on 2 chairs.
Thank you all. Thanks for the question. Another question chatted. Can you explain further how investing in preventive care through Medicaid actually saves money in the long run? Again, that's for anyone.
I mean, preventative care is so important. You know, having people be able to have access to annual mammograms, screening colonoscopies, things like that, allow us to catch some of these things earlier in their process, like an earlier stage of breast cancer or colon cancer, which ultimately saves the system money over time because the treatment required in a situation when it's very early stage is not nearly as costly as when it is widely metastatic and requires many more chemotherapy agents or surgical interventions. But the same can be true for other preventative issues like vaccines. Vaccines, we know we're seeing an outbreak of measles in Texas because of lower vaccination rates. And it's not just a rash and a fever. It can cause devastating consequences and it can spread very rapidly. And my own patient population is immunocompromised. And if my patients were to get measles, it could absolutely kill them. And patients who are immunocompromised often don't have the same responses to vaccines. So we rely on preventative care measures among the healthy population to help protect those folks as well. So it's going to decrease costs across the board. You're going to prevent hospitalizations, you're going to prevent costly surgeries, costly chemotherapy, costly medications if we can actually invest in keeping people healthy and catching things early.
I'll just add on to that, my entire professional career is based on preventive service medicine, right, in pediatrics. And so obviously the comments Dr. McCullum made regarding vaccinations I'll echo those and are essential. But when we look at screening for disabilities for children, when it comes to things like speech and language delay, emotional and mental health changes, those are all part of the preventive services that are provided in pediatric offices. So when we can identify and intervene in a much rapid manner, because children are coming annually for their visits, we're able to provide the services that the child needs, education and counseling potentially for families to help them develop those skills that they need to enter adulthood as prepared young adults who can handle the stresses of their life in society.
Thank you, all. And I see one more question at the moment. As physicians, what is the hardest part about watching patients struggle to afford the care they need? Again, that's for anyone.
Well, to be honest, as a physician, the horror is not visible to us because people don't get to our doorstep. The horror is driving through your communities and seeing unhealthy people who are afraid of going to a healthcare facility because they realize it may lead to debt that will take the roof from their head and food from the mouths of their children. And so it's painful to see instances personally, but it's the invisible terror that's the most frightening.
I mean, from my perspective as a rheumatologist, I deal with a lot of medications that are biologics, so they tend to be very costly in general. So, more than just Medicaid patients, but even my commercially insured or Medicare beneficiaries, um, these drugs, oftentimes they have to choose between their food or their rent and the cost of the medication. And we're fortunate enough that some of the patients qualify for copay assistance or foundational assistance to be able to afford these things. But these drugs have been literally life-changing in rheumatology, preventing deformities, disability, keeping people, active and living their lives the way they want to. But I've seen patients, because they can't afford these things, not do that and suffer long-term consequences, becoming permanently disabled and having incredible joint deformities that they can't function and perform basic activities of daily living like toileting and grooming.
I will just add as well that we are physicians here, obviously encouraging our legislators to listen to the concerns that we have and the knowledge that we have, that we know that this will impact our state in a tremendously negative way. But our patients and our families are also very concerned. When I have families that are in already very aware of the fact that their children are enrolled with Medicaid or CHIP and all the benefits that provides to them with regard to medicines, preventive care, vaccinations, and they're asking for assistance. So this is a community effort in terms of people and parents being aware that the health of their children is in danger. And that is heartbreaking as a physician to hear that. And we need our legislators to understand that this has impacts that are much wider than they've given the thought and scope to.
Thank you all, and thanks for those questions. I am not seeing any other further questions, so we will go ahead and conclude today's call. Thank you so much to our speakers, Dr. Taylor, Dr. Teig, Dr. Whalen, and Dr. McCollum. We appreciate your time and your advocacy on behalf of your patients and communities across Pennsylvania. And thank you so much to the media who were able to join today. I know it's a busy time, so we appreciate you being here as well. Hope you all have a good rest of your day. Thank you.